My passion at IMO has been to try and create for the clinician a clinical picture from the problem list. You know, over time, what happens to a problem list in any electronic health record is that it becomes kind of an attic of everything anybody ever said on that patient. And because it's an attic, it's complete, but because it's an attic, it's impossible to get through. I can't go to a typical problem list of 20 or 30, or sometimes we see north of 50 or 100 problems on a problem list and get a clinical picture of what's going on with my patient. If I can't get that clinical picture, I can't take good care of that patient. So we've spent a few years tackling this problem from our side, from the perspective of creating the content that makes the electronic health record work better. And the place we started is to say, well, if we can categorize a problem list so that it's more than just a listing of problems, then a meaningful clinical picture can emerge from that problem list. There's a secondary benefit as well. You see that in the second line in the little explanatory box on this slide. And that is that if my problem list is properly categorized, it's much easier for me as a clinician to go into that problem list and get rid of the junk on there. Terms that should have lapsed because they timed out, redundant terms, duplicate terms, and so on. So they get a sparser list, but still those lists need to be categorized into a display that makes sense to me, because if they are, then I can create a better care plan for my patient. I know what's going on with them, not just for the chief complaint that they came in with that day, but in the perspective of their overall clinical picture. And frankly, for me as a clinician, anything that decreases my cognitive load is incredibly helpful. Let me give you an idea of what this paradigm looks like from our side. What we did is go into our million or so terms that we put into a typical electronic health record and organize them into categories for both a specialist and a primary care doc who wants to see everything all at once.